Okay, so we've discussed earlier the Democratic presidential candidate Bernie Sanders' proposal for a single-payer healthcare system should be completely uncontroversial, should be obvious given what most of our friends in developed countries are doing. This is something sort of like a Medicare for all program, shouldn't really have controversy. But here in the United States, healthcare and people's well-being is a for-profit industry, and as such, it is an industry with lobbyists. And sometimes the lobbyists are exactly who you would expect, and sometimes they aren't. Howard Dean, our old buddy Howard Dean, is the latest in a string of Hillary Clinton supporters to say Bernie Sanders is wrong. Bernie Sanders is wrong to support a single-payer healthcare plan. This may come as a surprise to you, since Howard Dean has been a longtime supporter of single-payer healthcare, but apparently no longer. You'll remember in 2009, for example, Howard Dean went on Democracy Now! He said we absolutely need single-payer. It is, quote, by far the most economically efficient system. So I was very confused and perplexed, Lewis, to see Howard Dean on MSNBC a couple of days ago saying, actually, Bernie Sanders' single-payer healthcare proposal could result in chaos. Here's Howard Dean explaining.
If I could interject as referee for a moment, I mean, it strikes me that the sort of legitimate good faith attack is to say, look, it was really hard to pass the ACA. Opening up a fight on healthcare politically could backfire, which is the most charitable version of what Chelsea Clinton was saying, as opposed to the idea that, like, Bernie Sanders is going to try to take away your health care, which seems implausible.
I don't think, well, I mean, yes, Bernie Sanders certainly had no intention of taking away anybody's health care. The question is, would his plan result in the kind of chaos of trying to implement it that, in fact, would undo people's health care? That people should be concerned about. Look, we're never going to have a sensible debate about this between now and the convention. It isn't going to happen. There's too much politics in it. But in fact, this is the classic race of the visionary and the pragmatist, and I've chosen the pragmatist.
Yeah.
Howard Dean,
so
thank
listen,
you very much.
the pragmatist versus visionary debate is a legitimate debate, and we can have it, and we've been having it. But that has also become cover for just assuming everything Bernie Sanders wants to do isn't possible, and we shouldn't even think or talk about doing it because it's just not that likely to happen. If someone had said before George W. Bush's first term that George W. Bush was going to single-handedly get us into 2 long wars based on false intelligence, destroy the economy, a lot of people would have said, that's not possible. It's just not pragmatic to worry about that. Let's not really worry about that. The real issue here in this clip for me is Howard Dean. Howard Dean just is presented as MSNBC political analyst. This doesn't discuss that he is now a senior advisor to the law firm Dentons. The Dentons have a public policy and regulation practice, which is lobbying. That's what we're talking about here. They advise big pharmaceutical companies, including the Pharmaceutical Research and Manufacturers of America. They advise Pfizer. They advise Merck. All of a sudden, Howard Dean, who liked single-payer health care, is working for one of the big healthcare lobbyists. And for no reason that's connected to that at all, Lewis, he just is worried that single-payer healthcare might lead to chaos. What a surprise. I'm sure he just figured it out on his own.
Yeah, no conflict of interest. You know, he does have a point to some extent. The implementation of this over the ACA may get a little messy.
What would also be messy is getting rid of the Affordable Care Act now, right? Getting rid of the Affordable Care Act now would be a crazy mess.
Yes.
Republicans still want to do that.
That's true. That would be worse. But again, this is, I know he's just lobbying here. There's a clear conflict of interest. Let's put that aside.
Absurd.
No vision. You know, you need to look at the long term, and for-profit healthcare is just not a good thing. Dave, I don't think my health should be for-profit.
Absolutely. And this, we'll talk more about visionary versus pragmatist because it's becoming a way to just criticize Bernie, and I really don't like that.